Welcome to Digital Health Talks. Each week, we meet with the healthcare leaders making an immeasurable difference in equity, access, and quality. Hear about what tech is worth investing in and what isn't as we focus on the innovations that deliver. Join Megan Antonelli, Janae Sharp, and Shahid Shah for a weekly no BS deep dive on what's really making an impact in healthcare.
Hi, everyone. It's Megan Antonelli, and I am here with my friend Janae Sharp. Hi, Janae.
Hello. I'm thrilled to be here. We're back.
We are back. We took the summer off only from Five Good Things. We were working all summer very, very hard, but we took a break on reporting the Five Good Things. But we've been collecting them and tracking them, and we've decided to take the Five Good Things from the summer because it's been a pretty big summer. How was your summer, Janae?
My summer was great. My summer still, if you believe it can always be summer.
I live in Southern California, so it is always summer.
Well, okay, now you're showing off.
In fact, it has only just now gotten warm, and I am actually quite warm today in my office. But
so are you going to become one of those California people who every time we do good things, you'll be like, my 5 good things are I live in California, and then I live in California, and the weather in California is pretty good.
Well, in addition, although I don't want to wake him, in addition to good things, I also got a puppy this summer, but we'll wait because he'll wake up eventually and then we'll introduce him. But,
and I have a child. I didn't get him this summer, but here he is.
But did he have a good summer?
Yes. And he saw your puppy on screen earlier and he wants to see the puppy again. So we'll have to see the puppy later. Okay.
When he wakes up, I don't want to wake him up because then he'll be annoying. Anyway, so let's see. The first 5 good things, what did we have?
Wait, we're going to talk about good things. And the first thing is something about women's health with the American Heart Association. And they've done kind of a lot this summer. So maybe you can introduce the ones you think are great.
Yeah, I think so. The first post I saw was Lisa Sunin, who is now the managing partner at the American Heart Association Ventures. So she took the role and announced the starting of that venture fund. And in fact, there's been news about that all summer. And I think I think it's a $75 million fund. And then most recently, they had a donation from Sally Ross Soder, who's donating $15 million to the Go Red for Women's Venture Fund. And it's obviously focused on scientific research for women's health and cardiovascular. We've talked quite a bit about how that research has always been very male-centric, and it is, in fact, one of the number one killers, or it is the number one killer for women. And so this is super important work, and we're super excited to see money going to this space. And of course, we love the American Heart Association because we work with them, and we're working on their healthcare health tech competition that is going to be at their scientific sessions meeting in November. So it'll be exciting to see the developments around the venture fund as well as our competition.
Yes, I think that's great to watch what people are doing, especially at that event where there are a lot of clinicians there. There are a lot of people who are experts. Also, just to see people who are individually making a difference in women's health. There's historically been a giant disparity there where there's less research money, there's just less for women's health. So they're working to make strategic investments to bridge that gap. And we love to see it.
We do. It has been, and there's been a lot of good investment this summer around that space, which is good to see for sure. And we've talked a little bit. I think I was talking to Katie McMillan about, I think we're still waiting on the ARPA-H to find out where what some of those programs that they've accepted or are investing in are. But hopefully that will be on our good things next month.
Yes. And I love to see big organizations kind of invest in research, invest in smaller organizations or nonprofits to promote health. Let's go to our second big thing, which, as you know, everyone right now loves AI for the next however long they love it. Just kidding.
Yeah, well, it was certainly a big topic this summer. We had our Measuring the Impact of AI webinar or virtual summit, I guess, in August.
Chris Ross was great.
And Chris was great. We had some great sessions from Inovalon and Avashore and the folks over at Natera. And it is, I think we're getting to that point where some people have some really good use cases. And we're talking about where the value is, coming and where we're seeing value and we're able to measure it as opposed to talking about hypotheticals. So that's exciting.
Yes.
So a lot in the news, but our folks over at CHAI, at Coalition for Health AI, early in, I think it was like late June, so early-ish in the summer, released their draft framework for responsible development and deployment of AI.
Yes.
And
I think did he speak about that at the Health Impact event? We got to meet Brian Anderson at that event, and he shared some of those principles that they were getting many people together to develop and to share, to ensure that like AI has transparency and has lots of ethics, especially that's critical for healthcare.
Yeah, he did. He mentioned it, and I guess it was open for comment all summer. So it'll be interesting to see, what the response has been, and I'm sure there'll be something forthcoming around the response and what's next. And I think what I really like about how CHAI has focused on kind of the importance of AI in ensuring that groups like, underserved groups and underrepresented communities are included, and that, it's providing value where it's most needed within the healthcare system, as opposed to just sort of, kind of the healthy well, if you will.
Right. We also had a framework or guiding principles released by the College of Healthcare Information Management Executives, or CHIME, as we know them. And they released a report about 10 key concerns or 10 areas of focus that people should have when they're developing those. And I'm going to go through them because they're part of that good thing. Patient safety, administrative efficiencies, regulatory oversight. Wouldn't that be nice if AI could do that for you? Innovation and research, discrimination, bias, and equity, affordability, privacy, cybersecurity, high-speed broadband, education, and workforce. So
everything. I mean, those are really critical topics, and they're also, problems to be solved in healthcare. So I'd be thrilled, like if AI could help solve some of the affordability issues that people face in healthcare, that'd be wonderful. Yes.
Talk about a good thing.
And I think it's important. I mean, CHIME has done some great work around, sort of the leadership and the community and building the community. We
have a puppy visit.
We have a puppy. Good timing, Bear. And so,
my child heard and came to see the puppy.
And so I think for what CHIME, their role within the ecosystem, if you will, in terms of driving leadership and providing frameworks, it's really nice to hear, what their vision is for this and how how health system CIOs can really, take the right steps to ensure that they're not left behind in this implementation. And we talked a lot about it today, and in the interviews that I've been doing with a lot of our digital health female founders, it's coming and it's here, and there's so much possibility, and it is, the regulatory oversight hopefully will not hinder that innovation that is so promising.
Yeah, I think it'll be great. Let's talk also about some of the good things that happened on LinkedIn for me this summer.
Can't wait.
Suddenly, a bunch of government officials posted jobs. And I was like, I don't understand this job thing. Like, you guys are really excited about this job. And they're all posting the same jobs. Turns out they were new jobs. They weren't just posting their same job, but under a different thing. But there's been a reorganization for the ONC, for technology, cybersecurity, data, artificial intelligence, strategy, and policy. And Susanna Fox posted about it, and then some Mickey Tripathi and other leaders. So that was exciting for me.
It's a big
not only
deal.
because they all showed up in my feed and I didn't know, but also because it's a big deal.
Mm-hmm. Yeah, I mean, ONC's been ONC for a long time. It's going to take me a long time to stop calling it ONC, I think. I'm still calling CMS HICFA, and that certainly ages me. So it is, it's exciting. It isn't as catchy of a title, though. The Office of the Assistant Secretary for Technology, Policy, and the Office of National Coordinator in Information Technology, right? So it's Asked TP?
Asked. Well, Mickey Tripathi did once say when he was on there that he's not good at making those up.
At acronyms? Well, I don't know. That seems to be one of the qualifications if you're going to be a policymaker in healthcare.
To be good at acronyms. Some of them are very good. And I like him living his truth.
Mm-hmm. I appreciate that too. I appreciate that. So ASTP/ONC. And so I think the point, though, is that they're going to have increased responsibilities, right? And so it's in bringing in, really technology and data and AI policy, and which has been interesting because it's been interesting to see, like Troy Tasbaz from the FDA has had a lot to say about AI, and then at the obviously ONC and Mickey and that their team, and so this is interesting in that it brings it really under there, and it'll be really cool to see who they hire and bring in to bolster up that team.
Right, and as they've said in the past, and our HHS secretary says, often the challenge with government is making our regulation and regulatory bodies as agile as our technology advancements are. So we still have that gap in healthcare where there are some ambiguous areas in terms of regulation, because regulation doesn't move as quickly as our data is moving. And that's also exciting, but it's exciting to see them create some of that flexibility and they have now a chief AI officer and the chief data officer. So if you know who's going to get those jobs, please let us know in the comments. Or if it's
we'd love to have them on the show.
We want them on the show, but also if it hasn't been announced, and I also want to know that. That's a great thing.
The next thing we have that is more of like, okay, here's a use case on an area that we've been following, we're interested in. I'm really passionate about healthcare at home and the hospital at home movement and seeing where this goes, because I think it's so important. There's been multiple programs around home-based care and the value that it provides and what people want, right? I mean, not very many people want to be in skilled nursing facilities and nursing homes and sort of more temporary situations. And so figuring out how to make hospital from home work well, I think is super important. And I hope that they figure it out by the time I really need it.
You need it? Yes. We should talk a little bit about that, because when I read some of the news about that, I was like, well, that is not about you necessarily. But just the news, like my grandfather, before he passed away, had that. But then I didn't realize that Medicare hadn't paid for any of that. Like, so some of the big changes that happened were during the pandemic that Medicare expanded what they would pay for, which, we're not going to talk about any of the ethics or like whatever insurance reform. That's not our job. But if you are a policy expert, you should talk about it in the comments. But yeah, so the COVID-19 waiver expanded what people would pay for and what could be reimbursed across 37 states. And I know Atrium Health here in Charlotte, they made a big deal about some of their hospital at home moves, and clinical outcomes under that waiver were excellent.
But what's exciting, and so unfortunately, the good news, we don't have the good news to report, which is that it's been extended again. So it is, that waiver is set to expire, I think, in December of 24, right? So December of this year. So hopefully it will be expanded, extended once again. However, what is exciting is that we're seeing hospitals invest in it regardless, right? They see it as a competitive advantage. They see it as what their patients want. So I think one of the stories that I had highlighted was around Mass General. They've received a huge grant, like almost $5 million, around studying in-home rehab care for better patient outcomes. Hackensack just released a story on their hospital at home. We've talked to Terry Couts at Guthrie Clinic about the programs that they've implemented. And what's great is they're doing it because it's working, because they're seeing it. And I know I talked recently to a mental health, digital health provider, and around sort of the rehab and addiction programs that are happening at home. So there's a lot of activity there. We're excited to be covering it. And if you're doing work in that space, please reach out. Our health impact event in January is going to talk about that a lot. So we're super excited about that. And I'm just, excited to see that there's money coming to it, even if it isn't just based on the waivers, and where that is headed.
Right. And speaking of that, I love that more programs are becoming available to more people. Also, you were talking about behavioral health. Like, our last good thing was the Harris administration. They took steps to improve.
It's not
access.
The Harris administration.
The Biden-Harris. I said it wrong. Now we're going to have to. The Biden-Harris administration took steps.
I think we can keep that, actually.
You can keep it. You can keep it.
Mm-hmm.
When we don't, this is kind of a big deal. And we probably actually should talk a little bit about that. Like, mental health parity, payment parity has been a big deal throughout history. And I think this is super relevant to my work. People see this huge divide between mental health and behavioral health and like real health in medical education everywhere, right? So it's this law that says that you're going to get reimbursed or be able to have mental health care, that's 15 years old. They passed it. And I've heard the Kennedys speak about, the importance of being able to pay for addiction care. And it's really compelling. And then in practice, that law still doesn't exist. And the law didn't have a lot of teeth. What's the phrase they say about like legislation there were no, it was like just a suggestion. There wasn't enough to like make people do it. So 15 years later, people still hadn't done it. Mm-hmm. So they went ahead and released some things about what that actually needs to look like for decreasing out-of-pocket costs. Some of the things that I think are really interesting, especially to the IT world, are you're supposed to actually say if people are in your network. And I don't know if anyone here has tried to get mental health support, but if you call the numbers of people that are in your network to provide care, you might find out that information is incorrect.
Right.
Or if you try to get on a wait list for a program, you might find out that some of these coverages, they don't actually exist. Like, it's not actually accessible. Right. And
now, does the rule, and I should know this, but I don't, but does it require that the networks be also comparable? Because part of that is it's just that hard to find a provider in your network.
Yes. Not only should the networks provide just as much coverage, they also should provide the same amount of coverage for an out-of-network provider that you would be able to get for healthcare. And yeah, like, you should be shocked, because right now, I think it's 40% of people are paying for their mental health care out of pocket. There's been some concern about this law, obviously. A lot of people that are the best mental health care providers decide to not take insurance because there are so many barriers to getting reimbursed.
Right.
So,
well, and even now, just not even going into the field because it is so, the customer base, even though we're rather large, it's such an underutilized service because, these rules are not in place, and they're certainly not being enforced in terms of how it works. And it's interesting. I mean, and it'll be interesting to see how this impacts and is utilized within digital health with all the digital health, mental health providers. And, because of course it does, the reason the insurance companies haven't been doing it is because they clearly don't have the financial incentive to do it. And it's hard. Right. And so they have to figure out how to do it in such a way that they're not going to lose money on it. Right.
And but that's not my problem.
No, it's not.
That's not my job. It is also, I think it's relevant to my job though, because in the nonprofit, we are getting more, and they see this across the board, not just with our nonprofit. There's more need for mental health support and more demand than ever before. And parents will call us who are physicians, like the need can be staggering, right? But the payment availability is not. So people, and even you see that with like investment, with donations, like mental health is not something that we give the same weight to. And it's a huge problem right now. It's, the Surgeon General has talked about not only, kids needing help, but also parents right now needing help. So I'm thrilled that this seems to be moving in the right direction. And I don't know all of the technical implications. I just,
Yeah, it's so complicated, and it's been such a huge problem in the United States. And it is, part of it is mental health stigma. But, the bigger issue, I mean, these societal issues that we do talk about, that we are worried about, we're concerned about around homelessness and addiction, they're all, or in so many ways, tied to mental health. And when we basically got rid of the mental health system in this country, everything got worse. And instead of taking care of the mental health system and putting it back and bolstering it and making it available to people, we've done the opposite. And we've blamed these, ridiculous, reasons of why those things exist, that don't have anything to do with it. When if we had proper mental health care in this country for so many, there would be so many problems that would be a bit more, manageable. They won't go away. Yeah. But to turn a blind eye to it is, for lack of a better term, crazy.
Well, I'm not super pro institutionalization. Like, I understand some of that. I think also some of our problems are like, they're societal problems, they're a lack of connection. They're not all going to be able to be solved through healthcare. Like, we don't
I'm definitely not pro institutionalization. It's just that we never replaced it. We never put in a system where there was anything that, other than the jails, which is, that doesn't work. That's a really bad system.
I think we can argue that some of these things we need to make it more integrated. Like hospital home, right? We need to make mental health at home. Like, let's try to make it at least a little bit healthier for people and let them have rehab.
I mean, it's interesting because it's also, employers will say, okay, well, these services are available, right? We've got these wellness programs, and we've got these, hotlines and places to call and things to do, and they come to you through your employer, but people don't want to use them. They're underutilized. They don't have the level of engagement that people want. And it's interesting. I haven't seen stats and stuff about, Talkspace and all the others being utilized and offered through employers. And it'll be interesting to see over the coming years how the adoption on those things go and what it means for people's mental health. But I think there's a long history of saying, oh, well, it's available to you, but the place that it's available isn't the right, place for people to actually seek it.
Yeah, it's available to you as long as you have unlimited funds, unlimited time, and like unlimited support.
Right. Which if you had all of that, you wouldn't need it anyway.
You might, but like you're less likely to, right? Like, there are other barriers. And And this is, I think, scratching the surface of some of those accessibility issues where, getting actual support is a logistical nightmare. And we don't talk about that enough and about the reality of what it actually involves. So,
right. And so it'll be interesting to see. I mean, it's great to read this, statement from the White House at this, particular time in an election year that they're going to put some teeth in an old law, that's sort of overdue and, will it actually, what will we see from it? So it's good news. It's good news because we always celebrate attention and headlines and trying to get that, get the right conversation started. But this is probably just the beginning of what we can hope to see in this space around
absolutely.
True mental health reform and, real consumer protections around it that get people the access that they need.
Yeah. So I love that, 70% of kids who want to get mental health care or need it don't have access, half of adults. So, any one of our audience, if you know about this, we want to know who's doing great work. We want to encourage people to invest, just like investing in the research and improving women's health. Like, let's continue the good news where people are seeing those barriers and they are doing the right thing. Both insurers and both policy from the policy side, where our laws have teeth, and from an individual side. I think this is great news for me.
Yeah. I mean, one of the things that I heard about, which I don't know that much about, but I think we were at the HFMA SoCal meeting, and it was actually, ironically, it was the president of Cedars, I think, who was talking about, but we were talking about new build and that there's a new UCLA neuropsych hospital being opened, in downtown Santa Monica, I think. And it's, it's a partnership across multiple institutions. And, it's good to see that money is going to places to address this. And so hopefully the government can back those things and we can make some progress.
Absolutely. So
did we have any other good things? I mean, it's been a long summer.
We're back.
It's been a long summer.
This is a tough summer for me, but I'm going to be positive. So it's positive. We're back. That's a good thing. We're going to have some events.
We are. We have our next Health Impact in-person forum in January in New York, which we're excited for that. And we'll be going to some events this fall. Oh, there's Bear. He's coming to say hi.
Yeah.
And yeah, it's going to be a busy summer and it'll be really busy going into January and February. It's kind of crazy. I mean, it's been a busy summer already and, don't stop.
Yes. So as we continue on, we're thrilled. Our other good thing is always our audience. So you should like and subscribe and share it with all of your friends and some of your family. And that one guy you don't like, that's your relative, share it with him too. Because you're the reason we're here. And we want to hear more about your good things and about the good things that are happening.
We do. Well, thanks, Janae. It was good to catch up. Thank you, audience, for joining us. And that is Megan Antonelli, Janae Sharp, Bear, and
and Naveen, periodically.
And Naveen, signing off for 5 Good Things. Thanks so much for joining us this time. And we look forward to seeing you at another event soon.
Thank you for joining us for this week's Health Impacts Digital Health Talk. Don't miss another podcast. Subscribe at digitalhealthtalks.com. And to join us at our next face-to-face event, visit healthimpactlive.com.